Impression from the conference are really great. We could see, first of all, we had a good set of presentations between Simon, myself, Dr. Agnini and Dr. Agnini, and closing with Jalko, plus the demo that we did with iTero, I think hit the ground really hard. And then the engagement that we got after the press conference was also quite significant with all of us, right? People coming in and asking questions. And so I felt a lot of the positive buzz and people really genuinely interested with what we were saying. That's some of the things we talked about today, right? As I mentioned, the paradigm shift of the technology that we did, and it really started simplistically as, can we reduce the size of the wand and the weight of the wand, because our customers were complaining about that, right? And by putting the engineers, all our engineers around that problem, they came up with this novel technology, which is called MDC, multi-direct capture, which allows you to basically project the light from the front at the tip instead of back projecting it from the back. And back projecting the light in the confocal technology is adding a lot of complexities to the system. It makes the system more complex, heavier, prone to quality challenges, right? By simplifying that whole system, we basically made the Lumina not only simpler, not only lighter and smaller, but we opened up new opportunities. So the field of view now is much bigger, which allows you to capture the full mouth in just a couple passes. The depth of how far we can go also has increased dramatically, which allows you to go in places and capture data that we couldn't see before. So from the customer point of view, they have now a system that allows them to get the best accuracy in the fastest way, so that the patient doesn't stay very long on the table. And then they bring all the data in front of the patient and they can have a conversation about their mouth. And the photorealism of for example, the pictures, the intraoral pictures, are phenomenal. And that gives you a quality that we have never seen before. They love it. Obviously, it's better to talk to them, right? That's what we do here. But all the response that we got from the top doctor in Dubai, all the way here to IDS, it's a big wow. It's a big wow. They're like, we've never seen this. And you heard Dr. Ainini saying, I started to send my kids to the lab, but I didn't tell the lab that these kids were coming from Lumina. And the lab was asking, where is this coming from? I've never seen such a quality, such a precision, accuracy, colors, stunning. Where is this coming from, right? And this is the lab. If the lab tells you that, that means that there is something out there. It's continuing to build this digital transformation, which has to do with this comprehensive dentistry.
Leo.
We started, if you think about the scanning technology, it started with, I want to be able, instead of doing PVS, putting that goo in your mouth, disgusting thing, right? Instead of doing that, I want to have a simple way to print the teeth that I can send to the lab, right? It was basic digitalization. Fast forward today, it's not anymore about that, right? The scanning part is a very small element of the whole ecosystem. It's about, in one shot, delivering a full diagnosis for the patient. Do you have malocclusion? Is your gum healthy? Do you have caries with Neri? Are you grinding your teeth? Are you losing mass? And then here's the diagnosis. You could do this and this and this in order to improve your overall health, right? I think moving forward, this notion of ortho-resto or minimally invasive dentistry, meaning we want to do no harm to the patients. Removing mass is bad, right? So being able to fix the teeth, moving the teeth before you start to do any kind of restoration is going to become the standard of care eventually. It's not today, but eventually it's going to become the standard of care, which means that people will benefit from aligning their teeth, fixing their malocclusion, and then getting the best restorations that do not require removing a lot of mass from their teeth. That is the future of dentistry. Look, as I mentioned in the talk today, there are 4 pillars that every time we work on innovations, there are 4 critical elements we want to deliver on. better clinical outcomes. We talked about the Lumina. You can see with the data that we bring to the table, they can deliver a better clinical outcome because they see more. Very simple. And they make less mistakes. Growing the practice, which means financially growing, but also efficiency, also making sure that everybody in the practice is engaged with the staff experience. And then the fourth one is delivering the best experience for the patient. If the patient is happy and it goes painless, the patient will come back, right? So all of these play a major role for the dentist to grow their practice. If you tell them, look, we're gonna help you get a better experience for your patient that come back. We're gonna help you with retention with your staff because they have the best technology and you're gonna train them, they will stay with you. And then we're gonna help you elevate your game so that you can get more patients through the day, which means growing your practice thanks to all the tools, all the digital ecosystem that we are offering you, right? And finally, all of that by delivering a better outcome. So who would not want to do that for their practice and for their patients?